Today I am showing you what the risk factors are for the vulnerable population and COVID-19 and how you can exercise and stay fit to protect yourself if you fall into this vulnerable group. So if you know anyone that suffers from any of these conditions in my video, please share this information with them. It's Morris here from morrisfitness.com, and today I am talking about a very important topic. Yes, it's the so-called COVID-19 virus that's been spreading across the world and wreaking havoc on not only the economy, but also on the most vulnerable people we know. People over the age of 60 and with 2 or more conditions. And I think we all know somebody, or maybe even yourself, that fall into this vulnerable group. We also know from research, which I will show, that this is not just the elderly that gets affected by this virus, but also those with pre-existing conditions that are hit the hardest. Some of these preconditions can be eliminated, while others can be monitored, managed through various interventions like medication, nutrition, lifestyle modifications, and of course, exercise. The good news is that you can learn to overcome many, if not all of these conditions by educating yourself and modifying your behavior. Now, as a biokineticist, I evaluate, assess, prescribe, and treat almost all major conditions, including sports injuries, orthopedic conditions, chronic disease management, and neurological disorders, using nothing else but exercise, nutrition, and lifestyle modification. And today I am highlighting the effects of chronic obstructive pulmonary disorder, or COPD, on the current COVID-19 pandemic, and how exercise is a proven method that can be used anywhere, even at home. So what is COPD? Well, it's something that kills 30,000 people per year in the UK alone. Now that's a lot, so I think we should take this seriously. The Global Initiative for Chronic Obstructive Lung Disease defines COPD as a common, preventable and treatable disease that is characterized by persistent respiratory symptoms and airway limitations due to airway abnormalities, usually caused by significant exposure to noxious particles or gases. What does this mean? In other words, smoking, secondhand smoke, environmental air pollution, and harmful chemicals or dangerous work environments. COPD is an umbrella term that covers both emphysema and chronic bronchitis, which is pretty much the long-term inflammation of airways and mucus hyper-secretion. These conditions worsen over time, changing the lung structures, leading to breathlessness, coughing, and sputum production. Now, COVID-19 is caused by a new B coronavirus, SARS-CoV-2. Its epicenter was in Wuhan, China, and it has been spreading globally. And that's all I want to say about that, because research is still going on and could change at any point. As of March 31st this year, there have been over 860,000 cases worldwide, resulting in 42,000 deaths. But this number, who knows where it is right now? It has also been described by many scientists as another flu, but this time it has a higher infection rate, as we can see our healthcare system is being overrun. But the most significant fact is that persons older than 60 years with hypertension or blood pressure, diabetes, COPD, as well as cardiovascular disease, liver, kidney, and gastrointestinal diseases are more susceptible to the infection and experience a higher death rate when they develop COVID-19. This is according to an article in the American Physiological Society. Link is in the description. I urge you to please go and read this article. Although there is still a lot of debate about what is going on with the situation, there is a huge number of people who are susceptible to these infections, especially respiratory distress or lung problems, and that is the COPD community. That's why I chose COPD, as the signs and symptoms are very similar to COVID-19, and I felt the need to help inform those with COPD to strengthen their situation by strengthening your body and respiratory system with the help of exercise. The information that's in this video today can be used for any of the mentioned conditions, but today I'm only focusing on the evidence surrounding COPD. But just a disclaimer, and that is, do not exercise when you have been diagnosed with COVID-19 or flu for that matter, especially when you have a fever and associated flu-like pain and symptoms. The stress on your cardiopulmonary system would just be too much. However, you can start with a light, monitored exercise regime where the only limitation is your own ability, which ironically will change for the better the more you keep up with your exercise. So please share them and subscribe and leave a comment below and let me know if you have any questions. So what are the main symptoms of COPD? Number 1, increasing breathlessness, particularly when you're active, climbing stairs, walking, or doing work around the house. Number 2, a persistent chesty cough with phlegm. Some people may dismiss this as just a smoker's cough, even though you don't even smoke. Number 3, frequent chest infections, not just seasonal, but anything like the slightest cold. Number 4, persistent wheezing or noisy breathing indicating an obstruction. Without treatment, these symptoms usually get progressively worse. There may also be periods when you suddenly get worse, known as a flare-up or exacerbation. So far, some of the signs and symptoms match those of COVID-19, but with a few differences. The sudden onset of infection that has been reported, elevated temperature and flu-like symptoms, but only a doctor should test for this and diagnose you. For COPD, however, when should you get medical advice? You should see your doctor if you have persistent symptoms, particularly if you're over 35 and smoke or used to smoke. Do not ignore the symptoms. If they're caused by COPD, it's best to start treatment and lifestyle modifications as soon as possible. Because, similar to COVID-19, the damage to your lungs caused by COPD is permanent, leaving you even more vulnerable to future infections. But treatment can help slow down the progression of the condition. So what are some of the treatments for COPD? Number 1, stopping smoking. If you have COPD and you smoke, this is probably the worst, this is the worst thing that you could do, not just to yourself, but to the people around you. Number 2, inhalers and medicines to help make breathing easier. Number 3, surgery or a lung transplant. Although this is only an option for a very, very small number of people, and like any transplant surgery comes with immunosuppression medication that you need to take for the rest of your life. And number 4, pulmonary rehabilitation. This is my personal favorite. This is also a more permanent and long-term solution that puts you in control of your life and your health and well-being. Now, what's the outlook for COPD? The outlook varies from person to person. The condition cannot be cured or reversed, but for many people, treatment and regular exercise can help keep it under control so it does not severely limit your daily activities. Now, what exercises can I do to help my COPD? 2 studies have compared the use of high-intensity interval training or HIIT embedded within a 12-week pulmonary rehabilitation program to a no exercise intervention group on measures of exercise capacity in people with COPD. Those that participated demonstrated greater changes in VO2 peak compared to the control group who received no exercise. Now, for those who don't know, VO2 peak is the amount of oxygen that is taken up through the cardiopulmonary system at a certain peak or cutoff point and is measured in milliliters of oxygen per kilogram body weight. Now, I know that's a mouthful, but that's a good thing. It means that you are getting fitter and more efficient at a specific work rate. Not surprising at all. In another study of a sample of 85 people, average age of 65, the HIIT intervention comprised of a 45-minute session for 30-second intervals. Those that undertook HIIT demonstrated greater changes in measures of cardiorespiratory fitness, VO2 peak, and exercise capacity. Nevertheless, the take-home message is that exercise proves to show positive effects on cardiovascular fitness and work capacity. Having said that, I feel that during our current situation where we have limited options to exercise, I do feel that using the HIIT method helps you to get more done in as little time as possible, making this my number 1 choice for the situation. Now, the type of exercise itself is not that important as the work to rest ratio. So what I'm saying is that you could potentially choose any exercises based on your current circumstances and abilities and use these protocols to improve your cardiovascular fitness and work or exercise capacity. Now, for those who are lucky enough to have a stationary bike or treadmill or a rower, this is how you could use this protocol. Start off with a light warm-up on whatever you have available. After a minute of warm-up, you can increase your intensity in 2 ways. Increase the resistance of the bike to a level that you can maintain for 30 seconds or increase the speed at which you pedal. It might be easy in the beginning to just increase the speed rather than the resistance until you feel that you can start increasing the resistance. On a treadmill, on the other hand, the same principles apply, but instead of increasing the resistance, you can increase the incline or the speed or both. Here is an example of me using a rowing machine, using just the wind resistance, then using power to row through my legs and upper body and not speed. Another tool you can use is an adjustable step box. This is a great tool and also easier and cheaper. Simply start stepping up and down using a metronome, which you can download for free on your phone. Start with a slow pace for 30 seconds, followed by a fast pace, then continue for 20 minutes or as much as you can tolerate. Remember, with any activity, the general rule of thumb is that if you cannot talk while you're exercising, you're training too hard. But also don't have a chat with everybody while you're exercising. You need to focus on the task. What if you don't have a box or a treadmill or anything at home and walking outside is a no-go? No problem. Walking on the spot, marching on the spot can also do the trick. Use your metronome I just mentioned and start walking on the spot for 30 seconds. Then increase the pace for 30 seconds. Repeat for 20 minutes. Now, if for some reason you cannot do any of these exercise protocols, there is balloon therapy, where all you do is blow up a balloon, deflate and start again. What you can aim for is the number of breaths it takes to inflate the balloon to its regular size. The least number of breaths means the maximum forced expiration volume. There are also a number of resistance devices used in a similar manner. There is some evidence that this improves vital capacity, and if you don't have any balloons, I'm sure there are other things that you could find to inflate. Now, the following protocol is for a complete body at-home basic resistance program, similar to the cardio protocol, but instead of you increasing the speed or resistance or incline, we're going to do a set of work followed by a set of active recovery followed by another set of work. You can choose any form of exercise as long as you can do it for 30 to 45 seconds, followed by another activity of a higher nature as a recovery. First up, use what you have at home. This could be dumbbells, barbells, plates, water bottles, bands, tubing, or even furniture. We will split this into an upper body and a lower body split set. So first, let's do a shoulder and arm set for 30 seconds, followed by a leg recovery set for 30 seconds and repeat for 20 minutes. Next up, we can do a lower body and upper body split set. We can do a partial squat, wall squat, or sit to standing, followed by an upper body running motion. Get creative with your exercises and mix it up. There are so many to choose from. Just stick to the protocols and frequency of 2 to 3 times per week for a minimum of 20 minutes. That's it for COPD, guys. Thank you for watching. I hope you enjoyed this video and found it helpful. Remember, exercise should be fun or you're doing it wrong. Leave a comment down below and tell me what exercises you're doing at the moment. And please hit the like button if you like this video, and also subscribe if you're not already. And if you're looking for a program that improves movement and minimizes pain, head over to morrisfitness.com and check out my foundations course. Keep healthy and most importantly, stay safe.